This segment is sponsored by Mercy Health. May is Melanoma Awareness Month, and with the weather getting nicer, we need to remember while that sunshine is wonderful, it can also cause a great deal of harm. Dr. Jill Onesti is a surgical oncologist with Mercy Health Lax Cancer Center, and she is here to talk about some of the precautions we should take and what to look for when examining our own skin. And Dr. Onesti, it is good to see you.
Great, thanks so much for having me.
We welcome the sun in Michigan, but the statistics bear it out. The sun can be a very dangerous thing. Share that statistic that you told me about.
Well, the American Cancer Society releases results to let people know about the incidence of cancer throughout our country here, and that number is rising for melanoma. In 2021, there were over 100,000 new cases of melanoma that were diagnosed.
Oh my goodness. Okay, so who's most susceptible?
Well, people have a variety of reasons why they're susceptible, and there are some things they can control and some things that they can't. The people who are generally thought to be at increased risk are people who have lighter skin tones, lighter hair color, blue or green eyes, if they're prone to developing freckles, or if they burn easily in the sun. Those are all people who have an increased risk of melanoma.
I raised my hand. I think I'm all of those just about. Okay, so protection. That's obviously the first line of defense. What should folks be doing as far as protection?
Well, you mentioned earlier already that the sun feels great, and we're certainly excited in Michigan to start seeing it some more. But the sun actually has a lot of harmful effects on the skin. So trying to avoid being directly in the sunlight, if you can wear a protective hat, protective clothing, or if you can avoid being out in the sunlight during the peak hours when it's the strongest, typically thought to be between 10 a.m. and 4 p.m. If you're going to be out enjoying the sun, then sunscreen is a great option to try to help protect your skin.
So I've heard people say, my very own friends say, "Oh, I've got dark skin. I can take it. I can sit in the sun all day long." Not so, right? Doesn't matter the shade of your skin.
For them, their risk is a bit lower, but it is still there. And in melanoma, while we hope to find it early and treat it quickly, it is not something that anyone wants to go through. And if we can help prevent it for people, that's absolutely our goal. So regardless of your skin type, protection is very important.
Okay, so my physician looks at my skin when I go for a regular physical, and people, I know that you advocate for them to check all the time. What is it that we should be looking for, especially if we see something that's kind of scary to us?
Absolutely. So many people develop moles throughout their life. And when we're looking at moles, which are these pigmented or colored lesions on your skin, what we want to determine is it something that's concerning or something that looks more normal. And so there's some good mnemonics to help remember, and they're called the A, B, C, D, E's of the melanoma. So yes, asymmetry. So if you can draw a line down the middle of a mole and it looks the same on both sides, that's more reassuring. But if one side is clearly different from the other, that's a more concerning feature.
Okay, what's B? Borders.
B stands for borders. So if they're nice, smooth, well-rounded, that's reassuring. But if they're starting to develop little jagged projections or just an irregular edge, that can be a warning sign.
C, I know, is color.
Absolutely. Most melanomas are darker in color. And oftentimes we'll see a normal looking mole that all of a sudden has a darker area to it or a couple different shades. And that's also a warning sign.
Okay, and then diameter.
D is for diameter, and we often talk about it being the size of an eraser on the back of a pencil. That's not real specific. There can certainly be melanomas smaller and benign things larger, but it's a good rule of thumb. And probably another good one for D to help think about is being different. So if your body tends to make moles that all look the same, that's helpful. But if one is clearly different than the others, that's something you should mention to your doctor.
I know E is evolution, and that is changes in some way. We want folks to know if you see something that bothers you, you need to talk to your physician about it, and do not delay, because I know catching it quickly is important. Dr. Onesti, thank you for spending some time with us. Really appreciate it. So important.
Absolutely. Thank you so much for bringing attention to this matter.
Yes.